Assalamu alaikum. I welcome you to the general anatomy lecture that is fabricated for the first year MBBS and first year BDS. We will continue our muscular system. This is the last lecture of the muscular system in which we will discuss about nomenclature of the muscles. We will discuss about the nomenclature with examples. We will discuss about the blood supply of the muscles, their nerve supply, and some clinical aspects, most common clinical aspects. Firstly, we come to the nomenclature of the muscles. Nomenclature is basically the naming of the muscle. The muscles are named. They can be named because of their shape, like trapezius muscle, trapezium, that and rhomboides, serratus anterior, latissimus dorsi. Sometimes the muscles are named due to the number of heads of origin, like biceps, triceps, digastric, and quadriceps. Muscles can be named due to their gross structure, like they can be semitendinous and semimembranous. They can be named due to their location, like temporalis, that is attached to the temporal bone. Then supraspinatus, the name denotes, the name shows its location. Then intercostalis, intercostals. The muscle can be named due to their attachments to some structures, like stylohyoid. It is attached to the two bones, styloid and the hyoid bone. And cricothyroid, likewise. They can be named due to their functions, like abductor, flexor, adductor. They can be named due to the direction of the fibers, like oblique, like transverse, like rectus. This is the total. We did 7 naming mechanisms of the muscles. Now we come to the blood supply of the skeletal muscles. Blood supply is of all the muscles is basically comes from the arteries that are present with close to the vicinity of the muscle, and the arteries and veins along with the motor nerves, they enter into the muscle through neurovascular hilum. The arteries, they repeatedly divide into arterioles in the perimysium and the capillaries in the endomysium for the nutritive circulation. Here you can see, in this example, you can see the arteries, vein and the nerve that are labeled on the upper side, left side of this nerve fiber. They are entering into the perimysium. They are piercing the they are entering from the epimysium into the perimysium, and they are again going into the endomysium, where extensive needs of energy of for these muscles is fulfilled by the blood present in the arteries. Now we come to the nerve supply of the skeletal muscles. The motor fibers of the muscle, they are that are they constitute about 60% of the total neuronal content. It is composed of alpha fibers, gamma, and some autonomic efferents. Alpha fibers are large, gamma are small, and autonomic are fine variety of fibers. Alpha are myelinated, Gamma is also myelinated, and the autonomic efferents are non-myelinated. Alpha is extrafusal, gamma intrafusal, and autonomic efferents are they are meant for supplying the smooth muscles. Then we come to the other content, that is the sensory fibers that constitute about 40% of the total neuronal component, that has got myelinated and non-myelinated. Myelinated are proprioceptive and non-myelinated are nociceptive. What are these? Proprioceptive basically is the sense of position, and nociceptive is the sense of pain. The myelinated fibers are present in the muscles, fascia, tendon, joints, and the capsules, while non-myelinated are present within the muscles. What is motor point? Site where the motor nerve enter the muscle. It may be one or more than one. What is motor unit or myon? It is single alpha motor neuron together with the muscle fiber supplied by it. The size of the motor unit depends upon the precision, the muscle control. It can be small motor units that supply 5 to 10 muscle fibers, or they can be large motor units. As you see, the small motor units, they are uh, present where fine movements are required. Large motor units are found where gross movement or crude movements are required, like proximal limb movement. And the small motor units are present in the extraocular muscles because you have to have precise movement there. Now we come to the neuromuscular junction. What is this? It has got two parts. One is the neuronal part, and second one is the muscular part. The neuronal part is also known as a motor end plate. It has got presynaptic membrane that has got synaptic vesicles. The muscular part is a sole plate that has got synaptic cleft, granular sarcoplasm, nuclei and mitochondria, and subneuronal clefts. All are labeled in the figure that is present on the right side. You can see here the presynaptic membrane that has got calcium channels in it. This is another figure of the neuromuscular junction. You can see the myelination of the axon, but as it approaches the muscle, the myelination goes away and it forms neuromuscular junction with the muscle. Now we come to the nerve supply of the smooth muscles. Smooth muscles are basically innervated primarily by the sympathetic nervous system through adrenergic receptors. There are three types, alpha 1 and alpha 2. They involved in the vasoconstriction, and beta 2 are involved in the vasodilatation. Main endogenous agonist of these cell receptors is the norepinephrine, that is also denoted as NE. Now we come to the clinical aspects. The major clinical aspects of the muscles are basically the spasm and the sprain. Firstly, we will discuss about the spasm. It's the most common condition that can be due to overuse, muscle fatigue, dehydration, electrolyte abnormalities or electrolyte imbalance, or it can be due to abnormal nerve stimulation. It occurs abruptly and it is very painful, and mostly it is short lived. It can be relieved by gently stretching the muscle. Then, what is sprain? That is also uh, that can be due to overstretching or tearing of the ligaments. How can we differentiate between the sprain and the spasm? Sprain and the strain and spasm. In spasm, there is no injury to the ligaments or the fibers, but in sprain, there is some tearing of the ligaments. Then, how can we differentiate it from the strain? In sprain, you may have bruising around the affected joint, and in sprain, you may have spasm in the affected area, but there will be no bruising in strain. These are the most common clinical aspect of the muscle. By this we come to the end of this session, and we come to the end of our unit that we were discussing, that is the muscular system. Thank you for your attention.